2 minutes to Dr. Kennedy.
The gentleman is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in support of the Do No Harm in Medicaid Act, which will ensure taxpayer dollars are not funding the evil practice of transgender child mutilation. And I thank my colleagues from Texas and from Kentucky for sponsoring this important bill. As a father of 8 myself, I know we all want our children to grow up healthy, supported, and empowered. Children should not be subjected to a medical system that pushes life-altering medical procedures and hormone treatments that are incredibly harmful. As a family doctor for over 25 years, I took an oath to do no harm and provide my patients of all ages evidence-supported treatment plans. That is why, as a Utah State Senator, I led the way in 2023 by passing Utah's landmark legislation that banned transgender treatments and procedures for minors. As a result, I faced death threats and my house was vandalized by woke activists, as demonstrated to my left. I am not deterred. That is why I'm staunchly committed to getting this right and finding federal solutions, as I did in Utah, that will protect America's children. At the core of the practice of medicine is that we do not subject the patient to unnecessary and dangerous medical treatments. When it comes to gender transition interventions, puberty blockers, hormones like testosterone and estrogen, and surgical procedures, the evidence shows that this is the wrong approach to getting these kids the help they need. The most comprehensive and authoritative review of these practices was conducted in the United Kingdom by Dr. Hilary Cass. Her 2024 Cass review concluded that the scientific evidence supporting such interventions is remarkably weak. There is no strong, long-term evidence showing that puberty blockers and transgender surgeries improve long-term mental or physical health outcomes for minors, nor is there robust data on their safety or impact on development. In the United States, the Department of Health and Human Services last month released a peer-reviewed report titled Treatment for Pediatric Gender Dysphoria, Review of Evidence and Best Practices. This study concluded that harms from treatments, including these puberty blockers, cross-sex hormones, and surgeries, are significant, long-term, and frequently under-recognized in clinical research. The evidence for these interventions in minors is weak and insufficiently tracked, particularly for outcomes like fertility, psychological well-being, and quality of life.
Gentleman is recognized for an additional 30 seconds.
Thank you, Mr. Speaker. I'm proud to have protected the children of Utah and commend the 25 other states that have stood up for their kids as well. I urge all my colleagues to follow the scientific evidence and stop funding these horrific procedures on kids. I yield.